This tutorial covers how to submit data for the Outpatient Recognition Program, Target Type 2 Diabetes. Log into the data platform at aha.infosarioregistry.com/login using the username and password sent to you via email after registering. Pause here to review further details on screen now regarding how to register your organization and get a user account. You will submit Target Type 2 Diabetes data through Program Forms. Click either the icon under Get Started or the link in the left navigation panel. If your organization has submitted in the past for any outpatient recognition program, you may have existing forms under the Edit Forms section, like I do here. Each date represents the calendar year from which that data was collected. For 2022 recognition, you'll need to submit a 2021 form. If you or another member of your organization have started a 2021 program form for Target Type 2 Diabetes, you'll see that here. If so, click to start adding data. You can see I have a 2021 form for two other programs, Target BP and Check Change Control Cholesterol, already. I don't have a 2021 form yet for Target Type 2 Diabetes, so I'm going to click Add New next to that program. I'm submitting for 2022 recognition, which is based on 2021 data. So I'll type 2021 into the reporting year field. Hit Submit to start. Target Type 2 Diabetes has two tabs of data to enter, found under Tabs on the right. The first tab, Participant Information, contains questions about your healthcare organization. To be eligible for 2021 recognition, you will need to fill in all questions on this tab, including any follow-up questions that appear if you answer yes to questions 7 or 8. You must answer yes on question 10 to be eligible for recognition. The gray boxes on questions 5 and 6 cannot be edited. They auto-populate to the total number of patients entered above. That's because the patient breakdown by race and ethnicity, as well as the patient breakdown by payer, must equal your total patient population given above in question 3. Tab 2, Measure Submission, includes the measure denominator and numerator questions that will determine your measure performance and subsequent award status. There are 3 opportunities to enter measured data. The program's main measure, diabetes hemoglobin A1C or control, is required for award eligibility. The other 2 measures are cardiovascular disease-focused measures. You only need to submit data for one. Note that this program's main measure, diabetes hemoglobin A1C for control, is an inverse measure, which means it's measuring a negative patient outcome. A lower percentage indicates better outcomes. The other 2 measures, MIPS 438 statin therapy for the prevention and treatment of cardiovascular disease, and NQF18 or MIPS 236 controlling high blood pressure, are standard measures where a higher percentage is indicative of better outcomes. For award eligibility, in addition to answering all questions on the Participant Information tab, you must enter data for the diabetes measure and one or both of the cardiovascular disease measures. Choose whichever is easiest or demonstrates the best performance. Note that these measures are identical to those included in our other outpatient programs, Target BP and Check Change Control Cholesterol, so you may already have this data easily available. However, while these measures are included in other programs, the data is not shared between programs and must be re-entered in the Target Type 2 Diabetes form. Once all fields are complete and no errors are detected, the Data Entry Complete checkbox will become available on the Participant Information tab. Check this box to mark that you are finished entering data and then save. You can save or save and exit and come back at any time to revise your data. A snapshot of all data in the platform, complete or incomplete, is taken at the date and time of the recognition deadline to determine award status. but you can revise your data at any point up until the snapshot time. Let's start entering our data. Before you begin, make sure the data you submit is representative of the healthcare organization you're currently viewing. Look left under Currently Viewing or at the top right to orient yourself. I recommend having the data collection worksheet available or filling it out ahead of time for ease. You can find this worksheet by navigating to the library on the left. I'm right-clicking to open in a new tab. In the library, click on the Target Type 2 Diabetes Data Collection Worksheet to download the PDF. The worksheet contains additional guidance on how to answer each question, especially for question 6, which asks for that patient breakdown by their primary payer. Questions may change from year to year, so please ensure that you have the latest data collection worksheet, which you can find on the top of the first page. You can also use the official measure specifications for each measure, which you can find by navigating back to the program form, clicking on the Measure Submission tab, and then clicking the link for NQF 59, MIPS 438, or for MIPS 236. I've navigated back to the Participant Information tab to get started. The first question asks if your organization diagnoses and manages patients with diabetes, up to and including prescribing medications. A yes response is required to be eligible for 2022 award. The second question requires you to certify that the attestations entered in the form are accurate to the best of your knowledge. A yes response is also required here to be eligible for a 2022 award. Question 3 asks for the total adult patient population ages 18 and above who had an office visit in 2021 for your organization. When pulling data for this question, make sure you're saving this query and can further break down that same patient population by race and ethnicity and by payer group. My demo organization has 37,155 patients ages 18 and above. For question 4, input how many providers your healthcare organization has. I'm not sure exactly what that means, so I'll toggle back to the data collection worksheet, where I can see we are looking for all physicians, nurse practitioners, and physician assistants in your outpatient organization. Knowing this, my demo organization has 94 providers. In question 5, we ask for a breakdown of how your total adult patient population, ages 18 years and older, self-identify by race and ethnicity. This question is based on Table 3B of the HRSA Uniform Data System reporting requirements for 2021 Health Center data. The same question appears in our Target BP and Check Change Control Cholesterol program forms, so you may already have this information available. All fields must contain a value. Please enter a 0 where there are no patients. Here is the data that I have. If there are patients who have not disclosed their race and ethnicity, you can put them under the unreported, unknown total patient count. Once all the fields are filled in, an automatic total of what you have entered populates in the gray box at the bottom. This box must equal your answer to question 3. For question 6, take your total adult patient population given in question 3 and break it down by the patient's primary payer. Not sure which group is considered your patient's primary payer? Use the guidance on the last page of the data collection worksheet for questions. Here's the data that I have for providers and payers. If you're still not sure on some patients' payer groups, put them under the Other Unknown category. Once all the fields are filled in, an automatic total of what you have entered populates in the gray box at the bottom. This box must equal your answer to question 3. If it does not, say if I change my other patients from 1,326 to 0, an error will appear at question 3. Because this is a red error, I won't be able to save. For red errors like this one, I can delete one of the fields that's contributing to my subtotal to make the error disappear. This should allow me to save and come back later once I have identified the error in my data. However, all fields must be filled in to be eligible for recognition. So in order to fully fix this, I must eventually either revise question 3 or my payer group total so that way they match up. Questions 7 through 10 ask about your organization's protocols to assess and treat patients who have type 2 diabetes and related cardiovascular comorbidities. These questions are based on guideline recommendations from the American Heart Association and the American Diabetes Association. If you respond yes on questions 7 or 8, additional questions appear to gather more detail on your organization's protocols. You can select multiple options or select none of the above. I'll select the answers for my demo organization for questions 7 through 9. You won't be penalized for having specific protocols or tracking methods. These questions are largely a self-assessment to help identify where you may have gaps in standard best practices. These gaps may need to be addressed to improve patient outcomes. Your answers also help the American Heart Association create more helpful resources for program participants. Question 10 asks if your organization is committed to continuously improving strategies for addressing cardiovascular disease risk in patients with type 2 diabetes. You must answer yes to be eligible for an award. Selecting no generates a note that tells me I'm ineligible. Keep in mind, you can answer no to questions 7 and 8 and say none of the above on question 9 and still be eligible for recognition, as long as you say yes on question 10. Note that you must answer these follow-up checkboxes if they appear. Leaving these unanswered generates a red critical error, which will prevent you from saving your form. The final questions are housed in the Measure Submission tab. This can be accessed by clicking the blue icon with 4 lines on the top right. Question 11 is the denominator of the NQF 59 measure, which is required for recognition. This denominator asks for patients who had a 2021 office visit and have been diagnosed with diabetes. Using the NQF 59 logic, which again is located via this link, how many patients met this criteria? My demo organization had 8,252 patients with diabetes who had a 2021 office visit. Question 12 is the numerator of the measure. Of the patients with diabetes from question 11, what is the number of patients whose most recent hemoglobin A1C level taken in 2021 was above 9%? Make sure to review the official measure logic for all criteria. Patients with diabetes who did not receive a hemoglobin A1C test in 2021 still get counted in the numerator, along with patients whose test level was above 9%. Again, the lower the numerator, the better the clinical performance. My demo organization had 2,326 patients meeting the numerator criteria. In other words, 2,326 patients who were poorly controlled. Questions 13 and 14, as well as 15 and 16 are optional, but you need to answer one of these question pairs for recognition. Questions 13 and 14 are the denominator and numerator of the MIPS 438 measure. This measure asks for patients who are considered at high risk for a cardiovascular event under the American College of Cardiology and American Heart Association guidelines and were prescribed or taking statins in 2021, using the MIPS 438 logic linked here. When calculating, you can determine how many patients are in each risk group and provide the sum of all 3. But be careful not to double count patients who fall into more than one risk group. For full details on this measure, check out our video on how to submit data for check change control cholesterol. I'm choosing to leave these blank and answer questions 15 and 16 instead, since I already have data easily available for the next measure due to my organization's participation in Target BP. Questions 15 and 16 are the denominator and numerator of the MIPS 236 measure. This measure asks for patients diagnosed with essential hypertension whose blood pressure was less than 140/90 millimeters of mercury at their most recent 2021 visit. For full details on this measure, check out our video on how to submit data for Target BP. My demo facility had 23,991 hypertensive patients, and of those patients, 17,455 showed a blood pressure under 140/90 at their most recent 2021 visit. To complete your data submission, make sure you filled in both fields for the diabetes measure and both fields for one of the cardiovascular disease measures. Going back to the Participant Information tab, make sure all fields are filled in and check boxes are marked. Make sure the gray box on question 5 and then again on question 6 match the overall total patient population given in question 3. And make sure you've answered yes on question 10 if you want to be eligible for an award. In my review, I can see that I still need to complete the other public patient field on question 6, so that way my answer will match question 3. I'll do that now. Now that I know all fields are complete, the Data Entry Complete checkbox should be clickable. After that, I'll hit Save and Exit. Back under Program Forms, I now have a saved 2021 form for Target Type 2 diabetes. You can click on your form to return and edit your data at any time before the recognition deadline. Recognition is based on a snapshot of all data in the portal captured at a specific moment in time. As long as your data is entered and complete by that time, you are eligible for recognition. Look out for regular newsletters and additional communications from us to learn more about recognition. Thank you for choosing to submit data for Target Type 2 diabetes. If you have additional questions, please contact us at bit.ly/aqcontactus, or if you need help logging in, you can contact our platform vendor using the email address on screen now.